couple of things come to mind. One, climate change. I don't know if you're looking at global, but if you're trying to get something a little bit more kind of local, I would say kind of a disruption of primary care. So as we prepare for the next generation of workforce, making sure that they're getting the care that they need where they need it, and just anticipating where their needs are going to be, understanding that they might be outside of the health system, and the importance of community collaboration and getting them in touch with community resources that exist outside of the local healthcare system. So really anticipating around disruption of primary care.
It's going to be families and how we address families at home and children and also the grandparents as well, because they drain on people's presenteeism and well-being overall.
We've spent many years in health and well-being paying attention to individual level factors, and we need to keep doing that, but increasingly employers need to pay attention to organizational and job level factors, how work is actually designed and the environment it takes place within to promote true well-being and performance in the workplace.
I was just in a session about collaboration with companies and trying to help the workplace be healthier. So they were saying that if you have a basically healthy individual and they're employed in a company that has a toxic environment, that the healthy individual starts having unhealthy behaviors. So working on toxic work environments.
I think a mission critical opportunity that we definitely need to focus on is definitely being on the forefront and focusing more on mental health, both I think not only for children but for adults as well, and even expanding that more to how we can help a younger generation be more mindful about social media dependencies and ways that we can combat that, and I think that could be a great opportunity to only strengthen those initiatives that are going on.
I think the mission critical issue is meeting people where they are and having personalized offerings in the well-being space. Also, social determinants of health, I think that's a huge topic, and it's only going to become bigger and more important.
I have to say, it's cutting through a lot of the noise in trying to get the context right for people. So it's truly being able to understand where people are, meet them where they are, and being able to position whatever that health and well-being solution is at the right time that makes sense and is important for individuals, not necessarily on the time frame of the insurance plan or the employer, where sometimes the timing of the offering and the timing of the need don't necessarily align.
So the next mission critical issue that I think is definitely has to do with mental health and the stigma and breaking that stigma and letting people know that there shouldn't be a barrier when it comes to it and that it should be an open conversation.
I think the next major issue that is important for health and well-being for employers to unify in terms of making this an imperative for their own business. There's enough evidence around the impact that it can have, and there's a lot of trends that are moving in the direction. So I think a coalition of employers is joining hands and really signing up for this as mission critical in the next few years.
From what I've sat in on since I've been here, I'm hearing quite a bit and learning quite a bit about social determinants of health, and I think it's crucially important. What I'd like to see happen in the industry, especially as let's be honest, there's going to be dips, ups and downs in the economy, is how we take the notion of social determinants of health and knowing that you need buy-in from the communities, the businesses, and the vendors, how we take it from something that we're discussing to tactically, from an actionable standpoint, what we're actually doing about it. And I'd love to see it at a conference in a year's time, a few years' time, some case studies about how we've really made a difference